So I made my chart on Google Docs. So unfortunately, I can't show you what it looks like, but you can imagine it probably looks good. So the first thing on my chart is sodium. And for sodium, if it's less than 135, you're considered hyponatremia. Some signs and symptoms include nausea, headache, confusion, and fatigue. And some of the causes that can cause low sodium is diarrhea, heart failure, liver disease, and renal disease. And the other side of that is hypernatremia, which is when you have too much sodium, which is over 145. And some signs and symptoms are thirst, restlessness, and fatigue. And some of those that can cause high sodium is mainly you're not drinking enough, so you have inadequate fluid intake. For chloride, it's hyperkalemia when your serum chlorine level is less than 97, and you're going to experience dehydration as symptoms, everything you would with dehydration, like thirst, weakness, stuff like that. Some of the cause of that is you have loss of body fluids because you're dehydrated. Um, Hyperkalemia, your serum chlorine level is above 107, and you're going to experience vomiting and diarrhea. And some stuff that can cause that is you're taking corticosteroids, diuretics, or laxatives. For potassium, if it's below 3.5, you're considered hypokalemia, and you're going to have muscle weakness, paralysis, and heart dysrhythmias. The main cause is going to be from diuretics. It's going to drain the potassium out of your body. And the other side of that is hyperkalemia. When your potassium is too high, it's above 5. You're going to have still weakness, but you're also going to have numbness and chest pain and possible heart palpitations. And then a cause of that would be acute kidney failure. Calcium, on the other hand, you're going to be hypocalcemia if it's below 8.5. You're going to experience the usual signs, which is muscle cramps, confusion, tingling in the lips and fingers. And some stuff that's going to cause that is actually going to be dealing with your thyroid. So it's hypoparathyroidism or pseudo hypoparathyroidism. Could also be vitamin D deficiency, and of course renal failure. And if you're above 10.5, then you are hypercalcemia, and you're going to have increased thirst and urination, belly pain, nausea, bone pain, muscle weakness, confusion, and fatigue. What causes hypercalcemia is overactive parathyroid glands. Phosphate, you're going to be below 2.5, and it's going to be hypophosphatemia. You're going to have muscle dysfunction and weakness. Some things that cause that is alcoholism, burns, starvation, and of course diuretic use. Hyperphosphatemia is going to be above 4.5, and it's going to cause similar symptoms to hypercalcemia like thirst, increased urination, nausea, and so on. The thing that causes that is going to be renal failure. And then lastly is magnesium. So we have hypomagnesemia, and that is less than 1.8. And the symptoms with that is going to be severe drowsiness. You could have seizures. You're going to be irritable, and you're going to experience insomnia. And what causes that is going to be diarrhea, malabsorption, and inadequate dietary intake. Sorry, you can hear my nephew in the background. He's playing with his toys. Hypermagnesemia is when you're going to be more than 2.6. It's gonna, some signs are going to be impaired breathing, decreased respirations, low blood pressure, and low blood calcium. And what causes that is also renal failure.